A standoff is in the offing between the national and county governments over the fate of 20,000 UHC workers currently working under the national government. That's right. The Council of the Governors say that they will not absorb the UHC workers in the county payroll, citing insufficient funding, discriminatory job terms, as well as a lack of clarity from the national government. As well as the Council of Governors Chair Ahmed Abdullahi says counties will reject the transition unless their conditions are met. Now this puts into jeopardy that ambitious plan, remember, of rolling out that healthcare plan. Chumba is the one who's reporting.
The Council of Governors are raising a red flag over the planned transfer of more than 20,000 universal health coverage staff to counties by July 1st. At the heart of the dispute, the governors say, is the lack of adequate funding to support an increase in the payroll, demanding release of funds to support the absorption of UHC workers.
It's just transferring to us problems which we will not be able to deal with. And in the past, we have accepted certain arrangements in good faith, and Big Brother has not kept his part of the bargain. We don't want this to be one such arrangement. And that's why we're saying, cause the problem, deal with it until you ensure a seamless end to the contractual arrangement. And if you want us to take up those people, give us the money. That's simple.
Governors say they have not officially received the UHC payroll and don't accept it unless it comes with the money to cover salaries.
We will accept that payroll when they are in the proper job group and the resources that are required to pay them their salaries going forward is availed in the equitable share. And that is a position in perpetuity. That is a position by the Council of Governors, and therefore the UHC staff out there should know that while the ministry has said they have been released to us, officially we have not received their payroll and will not be receiving it unless it has the money that is required.
If MOH has continued to have them in their payroll for the last 5 years, we don't see the urgency of transferring them to us. Gratuity. There's also the matter of gratuity. These people will have worked for 6 years. We're not being told who's going to pay for their gratuity, and we don't have the money as counties to pay for that gratuity.
At the same time, the governors also faulted the contents of the Division of Revenue Bill 2025, arguing the proposed equitable share allocation of 405 billion shillings was below the recommended figure of 536 billion shillings.
All of you are well aware that at the beginning of this financial year, about almost 20 billion was taken away from counties. This one denies the residents and the citizens in the counties of fundamental services that can only be availed if we have adequate resources.
The governors further claim the current allocation ignores critical non-discretionary costs and the burden of newly devolved responsibilities, violating the constitutional principle that resources must follow functions.
An example is the library function, where not all resources have been released, and the counties have to continue running on them. On the other issue, we continue to condemn this idea of quite a lot of money being left in the Ministry of Health headquarters.
And therefore we are urging the Ministry of Health, in all the other programs that they feel that they need to ensure that counties are enabled in terms of mobility. Let them release resources so that the counties can be able to buy those vehicles.
They are now demanding an urgent meeting with the National Treasury, warning that continued underfunding puts the entire devolved system at risk. County governments are currently owed nearly 74.98 billion shillings in delayed disbursements. Chumba, Prime Edition.